on a cut, how many minutes a day of daily cardio? So I don't segment cardio in terms of daily, like how much should you do. I approach it with more so like a weekly amount that you need to hit. I find that this is really helpful for individuals who need to plug it into their schedule. And sure, with clients who are like, I'm struggling with recovery or, they're getting close to a show, I'll give more specified parameters in which I want to work within. But largely, I would say if you're weightlifting, no more than 15 minutes pre weightlift, no more than 30 minutes post weightlift. And if you have a lot of cardio to do, I would just segment it up into a different session entirely. Realistically, I have clients who are in a fat loss phase who are at 60 minutes. I also have clients who go up to 280 minutes per week. So it kind of comes down to how we're creating the deficit and how much cardio you need to do based on the rate of change that you're desiring. Number 9, tips to tighten loose skin. It depends how much skin. There is a certain amount of skin that realistically is not going to bounce back like the actual matrices of the skin itself they're already stretched out. And this is not something that personally I can say I see a lot of efficacy in a lot of like the laser treatments. I think for a lot of individuals who go through extreme weight loss transformations, then they're kind of left with the option of getting the skin cut off or removed. If we're talking about a very small amount of skin, don't overlook the importance of hydration, micronutrient intake, and then if you are enhanced and you are looking to supplement with something that overall is going to increase collagen synthesis, I think growth hormone is one that I would say is relatively safe compared to others. So depending on what comorbidities you have, maybe that's one that you should consider. It's not me recommending you start growth hormone by any means, but if we're just looking mechanistically, what can we do that would improve overall skin integrity? That would be a drug that I would say mechanistically is probably the closest in terms of achieving that goal. Now, past that, building more muscle. If it's an area that you're like, hey, I am not as muscular as I want to be. And realistically, I think this is something that is a result of not having the skin like stretched across anything. Then yeah, build some muscle. Like I can tell you with my quads right now, I carry a lot of fat in my quads. I don't have a ton of muscle. And the more muscle that I've built in my legs, the overall improvement of that skin as it's gotten better. And it's been generally, I would say, more favorable even for someone who doesn't necessarily want big, meaty, bulky quads. Number 10, your thoughts on Clen for a cut for a woman. How long of a cycle, where, and how much to administer? So it depends. If you're using it for fat loss, I would say the duration of the fat loss phase is really the time I'd have it in place. It's not one of those that you necessarily need to cycle on and off. A lot of people will say once you lose the effects, cycle off so you get the effects back. Realistically, Clen is one that those effects, the sympathetic drive, are going to drop off. It doesn't mean that the fat loss benefits have also dropped off, but if you take time off of it and you want that stemmed out effect, that can return if you cycle off. I don't like that. It's way too intense for me. And honestly, even 20 micrograms is quite aggressive in terms of those symptoms. So starting dose would be 20 micrograms. If that's too intense, you could always go down to 10. Recently, I did go down to 10 because 20 was just a little too much. I think it's a great non-androgenic PED. If you're enhanced, I think assuming that you have no comorbidities or potential risk for any kind of arrhythmias or cardiovascular issues, then it could be a consideration. But again, do so under the right supervision. Number 11, can you talk about thyroid health supplementation? Selenium is an over-the-counter supplement that is needed for the conversion for the enzyme that converts T4 into T3. That's one for a lot of people I am going to recommend. Now, iodine is one that oftentimes you'll read is very effective in supporting overall thyroid health. What I've found is that a lot of people are actually getting in enough iodine through their diet. Therefore, with supplementing, this actually exposes you to too high of an intake per day, which can actually make it to where then TSH rises, which we don't want. So I'd be careful with iodine supplementation. Overall, thyroid health is going to go down when you're in a fat loss phase and very quickly. So I would make sure that you're crossing all your boxes in terms of micronutrient intake. I use the app Chronometer to make sure I'm getting those in enough on a regular basis. And in times when I'm not, then I supplement.